All right, I'm really happy to present this case next. In the last cases, we did show a lot of class 2 correction that was really efficiently completed through just arch development, lower buccal uprighting, class 2 elastics, and pretty traditional way of solving some AP problems. But we always get questions on how do we manage full step class 2s or a patient who might have a little bit of a growth disturbance in the lower jaw relative to the upper. So I'm gonna go ahead and present Max. This may take a little bit longer just because it's a little bit more complex and I try to show a little bit more of the fixed functional appliance. So Max came to us, 12 years old. He was just entering his pubertal growth phase and he had a concern of overjet and overbite. So if we go ahead and we break down his case, we're going to go ahead and look at his diagnosis and then his phase 1, 2, and 3, and then truly go through how we treated this case so efficiently into a really high level of a finish. So if we go ahead and we break this down, obviously we have to start with his comprehensive aesthetic diagnosis. We're going to look at his teeth. You can see that he's in his late mixed dentition. His first molars are in. He was positioning a little bit forward in this picture. I apologize. What we're going to do is we'll show you this CBCT where he was biting down. You can truly see that he was a full step class 2 all the way. About 9 to 10 millimeters of overjet, full step class 2 with the molars, with both E's still ready to leave. So there wasn't like a late shift that occurred in one arch versus the other. So this was a full step class 2. Again, apologize about the photos. Nothing really not contributory in the x-ray other than the fact that we are starting to transition to his permanent dentition. When we really break down his cephalometric analysis, you can see that he has an A and B of 6. His mandibular plane angle is pretty normal, but really, when we look at this, he is a skeletal class 2, and we can slowly diagnose this as having some mandibular deficiency relative to the upper. The upper one to SN is only 106 and 8, so we do have a little bit of protrusion in the upper arch, most likely secondary due to the constriction. So we're definitely going to be able to treat some of this with arch development, but also with mandibular advancement, some sort of fixed functional appliance. So when we look at his problem list, we do see a class 2 div 1, maxillary arch constriction, increased curve speed. Pretty typical what we see with most significant class 2s. His treatment plan is going to be a Herbst or a fixed functional appliance for a year, followed by braces and elastics. Problem list is really truly trying to improve lip support, overjet correction for the lip eversion that he has, and try to get as much growth potential out of that mandible as possible. Remember, Herbst appliances do not change the genetic makeup of a mandible. We can't grow a mandible just like you couldn't take somebody who's genetically supposed to be 6 feet tall and somehow make them 6'5", at least currently. However, if somebody's genetically going to be 6 feet tall, there are situations where they won't reach their genetic growth potential, whether it's malnourished, whether they're just not exercising. There's a whole bunch of reasons. So the mandible is the same way. If we don't put it into an environment where it can grow and we don't give it its full opportunity, then sometimes we end up having a little bit of a lack of growth. So a fixed functional appliance just does a great job of advancing it, getting rid of the occlusal interferences, and trying to get that soft tissue musculature to really kind of help you out. Again, traditional problems that are associated with class 2s, but he has a really nice smile arc, just needs a little bit of torque and uprighting. So when we look at a fixed functional appliance, what's going to be our prescription for Damon Ultima? It's fairly straightforward. We're going to use procline brackets on the upper because we want to prevent retroclination. Obviously, in a case like this, the teeth are already upright. We're going to go ahead and develop the upper, which is going to cause more uprighting, and we're also going to have a class 2 effect that's pretty significant with the Herbst as well as class 2 elastics. We want to make sure that we protect the facial inclination of the incisors by using a procline bracket. What that's going to do is that's going to try, as long as we don't overpower it, it's going to keep the upper incisor at 7 degrees, which is what we want. And in the lower, we don't want proclination. We're going to prevent that. So we're going to go ahead and use retrocline in the lower 2 to 2. But you can see that those lower canines are pretty lingually inclined, so we're going to use procline in those to upright them. As far as bracket positioning, whenever we put a Herbst in, it's pretty simple. We're only going to put on the upper 4 to 4 and the lower 3 to 3. So 8 brackets on the upper, 6 brackets on the lower. Traditional bonding, so upper at 5.5, 5, and 5. And in the lower, I'm not worried about trying to overcompensate. As always, we're going to let the bracket positioning take care of that and level that curve speed in a normal way. So 4.5 in the lower incisors. And again, we're going to leave off the posterior brackets because we're going to immediately transition into a fixed functional Herbst appliance. Okay, so at the bonding appointment, what we do is we go ahead and we take a scan. We send that to our lab, which is AOA, and then they make a Hanks telescoping fixed functional appliance for us. Currently, we're using bands in this picture, but we've transitioned to 3D printed Herbsts over the last few times, and they've worked out beautifully. It saves an appointment and a lot less discomfort for the patient because you don't have to separate the molars. So let's go ahead and look at how this case was treated. It was 22 months, which is pretty much the ideal for a Herbst case. And when you see the treatment timeline, you'll understand why. I'm not a big fan of putting in a Herbst for 6, 7, 8 months and overactivating it. Seeing it's a fixed functional appliance that's growth-based, I like the kids to grow. So one of our protocols is just to advance that Herbst to the ideal, which is class 1 molar, and let it sit for 12 months. It's so much, to me, makes more sense than trying to put them in an anterior crossbite situation only to get the Herbst out in 7 months, because when I tried that, it was so uncomfortable for the child. And on top of it, there was a case where I overtreated and then I had to run class 3 elastics, which again, doesn't make sense. So you'll see how we activate these in a little bit. But I'm a 22 months start to finish for a full step class 2, which is great. Now, we're gonna highlight this initially just to see what we're doing. Again, phase 1 is going to be much longer in a Herbst case. It's going to be about 16 to 17 months, just because it's going to be 12 months with the Herbst, and then when you take the Herbst out, you have to capture the remaining teeth and get to the end of phase 1. So this is what it looks like. We'll go through this a little bit more. But again, Hank's telescoping Herbst from AOA. We use the Bicknell prescription, so if you are looking for something similar, just feel free to call AOA and use that. And there's a lot of testing that went into this Herbst. I've been using them for 20 years, and initially in my career, a lot of them broke and failed. So we've gotten to a really nice design that seems to hold up pretty nicely for 12 months. So let's take a look at Max. Here he is in the beginning. Here's his initial patient records. Again, a late mixed dentition. Here is at his bonding records. Again, we'll put on the upper 4 to 4, the lower 3 to 3. It's really important to remember not to put a wire in the lower anterior segment. And the reason why is because in the 3 weeks it takes to get the Herbst back, you're gonna get movement in those lower canines and lower incisors, and then that lower lingual arch won't fit nicely. So we put the braces on, we close the doors, put an upper wire in, take the scan, and then we reappoint Max for 3 weeks. So I didn't have Herbst photos for Max, so we're gonna go ahead and use our stand-in. Olivia was a patient that I've been tracking on a Herbst, and I fully documented her Herbst placement and cementation, so we're gonna use her as a stand-in model on what we do. So when we have a Herbst, we've gone ahead, we've sent it to AOA for a Hank's telescoping Herbst, and this is what it looks like. This is what the day of cementation looks like. We use Fuji Ortho LC on the bands themselves. We've got an adjustment kit. We've got a couple of 4x4s, some cotton rolls, and then we have our Herbst there with the Allen keys and the cap screws. Now, this is what it looks like close up. Again, on the left side, we've got the bands. I do use occlusal rests on the 7s, and I use occlusal rests on the lower 5s or E's. You can see that in the lower. I don't use a TPA. I find that inhibits transverse development in the upper and molar rotation, but I do use a lower lingual arch in the lower. I find that it just really helps kind of keep things tidy. When you look to the right, you'll see that those are Hank's telescoping pistons. One key thing to note, I do not use the apple core screw. What I do is I use a post on the Herbst and I use a cap. Now here's why. When I was using the apple core screws, which is basically the screw that holds the piston, they vibrated loose a lot, and I'd have to use certain agents to try to get that screw to bond, and it just was a mess. So the nice thing about these cap screws is that the Herbst sits on the cap, or on the post, and it doesn't vibrate the screw loose, and it's much easier. This is what it looks like close up coming back from the lab. This is a Herbst where they have fit the bands for me. Again, we are now using a 3D printed Herbst. So they 3D print the bands, the lingual arch, the rests, and then they solder on the cantilevered Herbst portions. But we'll do another one of those later when I have that fully documented. So what the side looks like, we don't extend it past the first bicuspid on the lower, otherwise it extends out the cheek. So in our prescription, it's very careful to say do not extend the cantilever past the first bicuspid, and line the tube up with the canine as the curve of SPI is flat. We want to use that cantilever arm to help intrude lower incisors and not create an issue where we maintain the curve of SPI. Okay, so this is what it looked like when we put the Herbst in for Olivia. We went ahead and advanced it to class 1. Overjet and overbite are both normal. Yes, a lot of your patients are going to have a posterior open bite when that occurs, and that's simply because they have a curve of SPI. We just tell the patient that it's going to be fine. They'll be able to chew. After about a couple days, they'll get used to it, and all patients seem to. So we'll advance that Herbst to a really nice class 1 and just go from there. So here are the pictures of the Herbst in place. We have that lower wire in now. We start with an 014 segmented, and then we'll extend to that little arch wire tube on the lower cantilever once we hit an 018. And you can see how nicely that's going to help intrude those lower incisors. Same with the upper, we're an 014, we'll extend it to the arch wire tube when we hit an 018. But again, this is the Herbst cementation. Patients do really well, really quite nice. I do have a Herbst video. You can see a segment of this right here. It's just about 9 minutes long. So one of the things is that we are going to post this in our UOA free resources page. The entire video will be online after this case is presented, but there's a little snippet of it. And again, if you want to check that out, go to ultimateorthicacademy.com, sign up for our resources page, and the whole video should be there. We really do like to promote as much free education as possible. It's just, again, it'd make this video way too long to include that. So we're going to move back from Olivia back to Max. So now Max is at a point where he's had his Herbst taken out after 12 months, and this is what it looks like. So we have his Herbst taken out, we clean up the teeth, and we let it sit for about 2 weeks. I used to take the Herbst out, put braces on, start elastics, and it was just too much. It was really hard on the patient. So plus there's usually inflammation in the gums and you can't get the brackets on properly. So we wait about 2 weeks. Don't worry, they're not going to fall back. What happens is the patient comes in 2 weeks later. We go ahead and we put the rest of the braces on in the posterior, the 7s, the 6s, the 5s, on the upper, 7, 6, 5, 4 in the lower. And we usually thread an 018 copper nye tie through there and then begin class 2 elastics from the upper 4s to the lower 6s to hold that. So this is what it looks like at 13 months. Now, from here, this is a simple class 1 case, and we can start knocking down the dominoes, if you will, of getting through phase 1, phase 2, and phase 3 the exact same way we would anywhere else. And this is why Damon Ultima is so special, is because once we solve these problems, the end of treatment, as we've shown over and over and over, becomes very predictable. So even if this is at 13 months, we know it might be another 4 to 5 months before we get to the end of phase 1. So right here at 16 months, we're at the end of phase 1. We're in 140275 nye ties, and then we can begin phase 2. So let's go ahead and look at what happened in the first 16 months, right? We went from essentially, again, he was positioning forward, but you can see here now, we are in a full step class 1 on the right, full step class 1 on the left, bicuspids are socked in. We've got nice arch development, nothing that's too crazy. Lower arches resolved, lower incisors looking pretty nice. We now have an 180275 in going into phase 2, and we can start working on torque. So here is that timeline again. You can see we start with an 014, and then we place the 014 a month later when we put the Herbst in. We go to 018, 140275, and then we just keep an 180275 nye tie in there. There's no reason to go to steel. The 180275 nye tie keeps a really nice level of control. As long as you have posts and tiebacks, you want to make sure that you're not opening space as the upper 6s relatively distalize. You want to make sure that you put the post on the 180275, tie it back to the Herbst so that you really keep the upper arch nice and consolidated. And then from here, once the Herbst comes out, we go back to the 018, 140275, start class 2s, and here we are. So again, that's the end of phase 1. From here, this case gets very simple. Just like all other Ultima cases, we go through 3 months of phase 2. Phase 2 again is where we put an 180275 in, and then we reposition any brackets and then finish up that. So you can see 3 months of phase 2. Again, 180275 upper lower. We upped our rubber bands to rabbits and we repositioned in the middle. So now we move on to phase 3. Now phase 3 is where we're trying to finish this case. He's at 19 months. We want to make sure that we really kind of sock this in. You can see we've gotten a little bit of slip on that right side, so just have to really make sure that he continues to wear his elastics, which he does. So from 19 to 22 months, he's wearing his rabbit class 2s from the post to the lower 6s, making sure we sock that occlusion in. We set up his pathway to finish, which is very important coming out of class 2, so these kids have an idea of when their braces are coming off. And you can see with an 180275 steel in the upper, 160275 steel in the lower, class 2 elastics right and left, we're able to finish this case. A week later, he gets his braces off. His head was up here, he was pretty happy, but he did have a really nice smile arc when we were done. And you can see total treatment time of 22 months. This is a very, very typical way of us treating a full step class 2. And it's gonna really, really kind of benefit to see how we cement that Herbst. And again, feel free to use AOA Bicknell prescription if you want. So again, beginning to end, again, we were able to really reach our objectives, create a beautiful smile arc, upright the canines, get a nice arch development and hold torque in the anterior. The lower incisors are beautifully upright. We've got a socked in class 1 occlusion. This is really what we're looking for. These are stable. And what we really know is that we didn't overexpand. We didn't over upright. Everything looks really, really quite nice. And again, this is the total timeline, 22 months of treatment. It looks complicated, but it really isn't. It's just that when you're dealing with fixed functional appliance, you've got a few more steps. We do charge a little bit more for these because the fixed functional appliances cost money, and we know that's going to be a little bit longer, so this would be one of our level 2 fees. But again, completely worth it. Look at his chin development. He went through puberty during this time. At least part of it really helped us out with growth. So we can really look at these x-rays and see what we're dealing with. X-rays look nice from pan. When we look at the final Ceph, you can see where we started, right? 83 with an SNA, a 77 SNB with an A and B of 6, and then we can look at the E line as well as upper 1 to NA. Look at how much correction we have here. SNA went down to 78. We got some remodeling of A point, probably some headgear effect. SNB 77, A and B of 1, which is really quite nice. Upper 1 to SN went down a millimeter. Lower 1 to NB went up a millimeter, and we maintained really, really nice angulations. But if you really look at the E line, this is where it really kind of performs. We're able to bring that lower jaw forward and really, really help him out. If we look at transverse development through the phases, phase 1, phase 2, you can see that we really maintain this really nice natural arch form, which is what you're seeing with this. We don't overexpand arches. We really are looking at that lower buccal uprighting and then just setting that upper on top of it. This is really a musculature-based result. We're not trying to take the arch wires and expand it any further than truly what the muscles are giving us. Let's go ahead and look at the transverse smile development. You can see right here, he's starting to get a nice width. He started out pretty narrow and ended up with a really nice natural width. Again, his head's tipped up a little bit, but all in all, it looked beautiful. Now let's look at his profile. When we started, you can see that he had lower lip eversion, retrusive lower jaw, lip strain, increased nasolabial angle, and you can see just by placement of the Herbst, right, what happened. We were able to bring that jaw a little bit forward, and then through the finishing of his puberty and his growth spurt, you can see that he ended up with just a beautiful facial profile and a really, really, really good-looking young man. If we look at it through the 3/4, you can now see really his lip strain in the anterior, and there it's gone, right? So this is one of the things I try to tell people about a Herbst is that, yeah, it's clunky, it's annoying, your kid may not like it, but immediately you're solving the problem. So within a week, you're gonna feel so great about it because now the face relaxes, breathing gets better, the jaw comes forward, the lips relax. I mean, the kids really don't mind it, although they do like when it comes out. And you can see here just how great this kid looked throughout his transition. So to recap, 22 months of treatment, really, really nailed in all of these aesthetics. Microaesthetics, as always, with Damon Ultima are great because we're able to dial in the torques. When we look at Max, 22 months, solved his issues, and we're really, really, really happy with how this turned out. So if you want to check out more of this, please check us out at ultimateorthacademy.com. Follow our socials. Again, try to put out a lot of great information. And as soon as we can, we're going to put up the full video on how to cement a Herbst that is banded, fixed functional in the way that is easy, clean, and predictable. And it doesn't take long. Again, thanks for watching, and take care. Bye-bye.